morning. Thank you very much for making it in so early this morning. It is an early appointment, yes it is, 7 o'clock in the morning, but there's no need to worry. It means you can be up and running for the rest of the day. Perfect. Good job. I've had a quick look through your notes. Now tell me something. How's that abscess doing? Because obviously this wisdom tooth needed doing a few weeks ago, right? Yeah. Okay. I know, when you came in I found quite a bad infection all around the area. How's it feeling? Better? Very pleased to hear that. I'm going to be having a little check on that just before we do anything today. I want to make sure that infection is completely gone. Okay. Good. And how are you feeling? Are you feeling quite calm, steady and ready? Perfect. Well, that's fabulous. Good, 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 and good. Now, let me have a little look. I am going to have a little dig in your mouth because I just want to be sure that that infection is fully repaired. We can't be starting any procedures like this if you're not completely ready, can we? So I'm just going to take my gloves out. What's that? Oh, there's no need to feel nervous. No, absolutely no need whatsoever. Honestly. Look, something we're going to need to consider. You won't be able to drink alcohol for a couple of days. I would stick to very soft food. I would try not to chew on that side. Yeah. But that's only going to be for a couple of days. And there may be a couple of very small stitches, depending on what the wound looks like. If there is, I may have you back in 7 days to have them taken out. However, it very much depends on what it looks like when we're finished. Because if it's clean and lovely, I might just leave it for you to manage yourself. Now, I will send you home with a course of antibiotics just to ensure we don't get infection there. All right? Lovely. Okay, I'm just going to swap my glasses over for a moment. Bear with me. I'm going to need, I tell you what we'll do, we'll pop this on first, and then I can put my glasses over the top, can't I? Let's get that on. There we are. Put that down. There we go. And I'm just going to want to have a little look, quite deep. So could you just open up for me? Just open up a little bit, please. Open up. Lovely. That's it. I'm just coming in. Can I just open? Could you just push that for me? Push. That's it. Pushing that open. Right. Let's have a look along that gum line. My finger around your tooth. Bear with me. There we are. Let's go in on the other side. Right. So pop 2 fingers in. That's it. Well, that looks pretty clear to me. That's a good sign. All right, I'm happy with that. Okay, let's get you back into position again. Right, I'll just swap these back out again. Okay, I am very happy with that. Yes, I am. Very pleased that it all looks perfect and ready for us to get in there. All right, perfect. Well, let's get you to just lay yourself back, please. Can you just lay your head back a little? That's it. Good job. Right, you're in the perfect position for me. You stay there. I'm going to pop a little guard in, all right? This is just going to help you keep your mouth open the whole time. If you feel at any time you're getting a strong gag reflex, tap on the chair and I'll give you a little break if I can, all right? All right, good job. Right, let's just bring this guard in. And going to want to slip that under that. Oh, that's lovely. 1 minute, let me get it around the other side of the tooth. Beautiful. Perfect job. well held open. Well, look at your lovely mouth all open. That is fabulous. Look at that. Beautiful. Looking perfect. Now, I'm going to numb the area slightly for you, okay? Because we're going to have a series of injections today. I know we've spoken about this before, and you're quite all right with injections, you said? Good. Well, as I say, we're just going to do a little numbing of the sections first, so that way there's a minimum of pain involved. Right, so we're just going to put my little swab into there. That's it. Right, now I'm just going to wipe this. I'm just going to be swabbing very gently around the back of your mouth, around the gums, and where that wisdom tooth is. There you are. There you are. That's it. Just swab that. Lovely job. Excellent. Right. Now, of course, I do have quite a large selection today of needles. We are going to have a few different injections, all right? Okay. That's no problem. Right, the very first one I'm going to be putting in today, we're going to be numbing the area, so that anaesthesia has just given a little numbing of it, okay? I'm going to pop in another injection. The first one will really sedate that area, okay? And then once that's done, I'm going to put some actual anaesthetic in, yeah, which is really designed to wear off slowly. So after the procedure, you're not suddenly in, you know, an enormous amount of pain, right? Good job. Right, well, let's get you all prepared for this one then. Okay. All right. Now, if you can stay quite still, this is probably the one you're going to feel the most, okay? But do not worry too much. There we are. It's going in. Barely felt that, did you? Little bit cold now. That's it. Just gonna pop that in. Lovely job. Well done. Not even a wiggle from you. I'm very impressed. Okay, right. Let's get on with it. We don't want to keep you in this chair for too long. Just gonna give you a little swab out there. Let me just clean that area. Can we have the dry air on ready? Lovely, thank you very much. Okay, so what I'm going to begin to do today, I'm going to have a little drill very gently around the edges of the tooth. That's right, just a small drill separating away. Once I feel that we've got enough of a loosened gap, yep, that's right, there'll be a small incision. Yep, okay. All right, I'm actually going to pop in that anaesthesia now, okay? It's just a small one, it's nothing too big. It will go in 3 places, they're around the tooth, so we've got 3 injections. So, when you're ready, nice deep breath and breathe. First one going in. That's it, and we're just gonna lower that in a little. Okay, take that out. I'm just coming in on the top. We're going in from each angle. And from this side, a little bit more. Just a little bit more, lovely. And I'm just going to do around the bottom of the gum line as well. If we can just take that in there. That's perfect. All right, how are you feeling? Yes, I'm sure it does feel like the side of your face is sliding away, but I assure you, it's not. It actually looks quite perfect. Yes, it does. Now, will you allow me? I'm just going to tuck this up and underneath your chin. Don't want to get your nice clothes dirty, do we? Come on in here. There we are. Let's just get that and just pop that right in there. How's that? All right? Nicely covered? Well done. It can actually be a bit cold in here, I won't lie. Right, I tell you what, I'm just going to pop on my shield for this procedure. There we are. And if you don't mind, I'm going to be double gloving as well. It can get a little bit messy at this stage. So nothing nothing for you to worry yourself about, is it? No. Just one. Okay. Put my fingers into there. And get everything pulled up. Right, fabulous job. Okay, all ready. Yep, you've got this. Right, I'll be going in with the drill initially, just around the edges. Oh, here we go. Let's put the drill bit on. Okay, open up please. Open up. There we are. Right, you shouldn't feel too much. Good. Well, you shouldn't be feeling too much at all now. Just a slight bit cold. There we are, just keep drilling. There's the job. There, great. Alright, that's pretty loose. Just going to get a couple of tools in. Just getting in under the gum line, alright? Okay. There we go. I can just scrape around there a bit. Let's pull that skin back. And how are you doing? Good. I'm breathing okay. Alright, good. Keep that going. Nice deep breath. Remember to breathe in through the nose. That's it. Yes, in through the nose. Out through the nose for this. Excellent. Right. Just going to get out a little scalpel for you. Other tools around here. You're doing very well. Yes, the skin's nicely removed from the area. So, coming back in again. Alright, I'm coming in now with the... There we go. Just need to just get in there. Cast a little bit of light on it. Pull that over. Alright. Right, we're going in with a small incision. Okay, small incision. Coming in now. There. That's it. Nurse, can you get the suction on that, please, if you wouldn't mind? Yep, suction on that immediately, please. Bring that in, please. Can you just... Yeah, oh, there it is. There it is. There we go. Alright, okay. I just want to have a little look at that. Stay just where you are. Let's get a good look in at that. Alright, yep, I see. Okay. Alright. Quite happy with that. I'm going to be pulling away again at the edges. Right, deep breaths for me, please. Deep breaths. I'll count you in. 1, 2. This bit can feel a little bit brutal, but we're just edging away. 3. That's it. I'm just pulling away at the edges. Deep breath. 4. You're doing ever so well. Just put my fingers in there. 5. Excellent job. Alright, we're nearly there. Keep that breathing going for me. Okay, alright. I'm going to be going in with the tweezers now. I'm just going to pop this swab in for a second just to clean that area up a bit. Alright. Right, this can feel a little bit tugging, okay? Very brutal. Oh, okay, you're going to have a gag. Right, just take a breath. Take a breath for me. Hold it there. And out through the nose. Well saved. Right. Here we are. Right, I'm going in. Okay. Just... So it can be a little bit tricky. And we're just trying to... Sorry, I was going to pass me one of those other tools again. Just the sharp ones. Yep, that'll do. Just gonna loosen a bit deeper. How's that feeling? You can't feel it? Good. Just feels like rubber bands pulling a bit, doesn't it? Alright. Okay, I think we've got you here. Here he comes. Here he comes. Let's give a good tug. Okay, nearly there. Done. That's it. That's the worst of it. Can I get that suction in there, please? If you don't mind suctioning. Lovely. Now we're cleaned up, please. Wonderful, wonderful job. Right, let's have a little inspection on there for you. You know, that was very, very clean. I'm actually just going to go in with a bit of swab. I'm also going to put a little bit of antiseptic on that. Let me just swab that antiseptic all inside the wound and around the edges. I'm just going to bring our medical lamp down. You might want to close your eyes for a moment if you could. You just close them for a moment. That's it. Let me just work that anaesthetic and make sure that we're completely clean as well. I think I'm rather happy with that actually. That looks pretty good to me. And you did so well. Alright, let's put that frame back over there. Right. And how are you feeling right now? Good. Well, that's excellent news. Absolutely excellent news. Yes. Well, I'm rather hoping, you don't need stitches, it's pretty clean. You do have rather a large hole, but that is perfectly normal, perfectly okay. So, what I would like you to remember, I'll give you a list of things not to be eating. Please stay away from bread, alcohol, anything that's got a sharp edge to it that's going to be really irritating that area. We don't want that. No. I'm going to have you back in a week's time for a first checkup, and then I'd like you back the following 2 weeks later, just to make sure that that heals really nice and clean. I know, you were very worried that wisdom tooth was going to push through and destroy that lovely line of teeth that you have. I mean, your teeth are just beautiful. And I think that was the main concern, really, is that that tooth was pushing in at such a sharp angle. There was every chance it was going to dislodge and rearrange the shape of your teeth at the front. And we can't have that now, can we? Okay. Can you just take a seat there for a minute? I just want you to relax for a few moments because it's quite traumatic having a tooth out. It can feel quite shocking. So I'm just going to get you to sit there just for a couple of minutes. Close your eyes if you like. Just close your eyes for a second. That's it. Close them. And I'm going to play you just some soothing music for a few minutes. And then, after a couple of minutes, I'm just going to have another check in your mouth just to be sure that I'm happy to let you go for the day. How does that sound? Good. Well, that's excellent. You've been a rather marvellous patient, if I'm very honest. I've had much worse in the chair, I can assure you. Okay. Well, why don't we have a little look in your mouth again? Okay. All right. How are you feeling? Good. And relax. Perfect. Right. Now, you shouldn't feel anything, so please don't worry. But I'm just going to slip these two fingers, these two here, and I'm going to slip them down the side of your gum line. There they are, going in. Do you feel them? There you are. Let me just rub that gum line. Is that okay? Alright. Good. I'm just going to put a little bit of suction on again. It's alright. Just want to clear away. There we are. Just a little bit of those liquids. That's it. I want to be able to see clearly into your mouth, don't I? Yes, I do. Your mouth is my most important thing at this exact moment in time. Alright. Take these two fingers now, and we're just going to slide those carefully along the gum line. You feel me rubbing there? Alright. Can I just check on the other side as well? I'm just going to open you a little bit. Let me open up your mouth a little. There you are, let's get right in. Right, I'm going to take 2 fingers in and we're going to just separate you. There we are. Good job. Does that feel alright? Yes, these gloves are slightly different to my others. These are very silky. I'm just going to open you up a little. You are doing exceptionally well, I promise. Great job. Alright. I'm very happy with that. Yes, I am. I'm super pleased. That looks so clean and so good. Why don't we get this off you? Come on, let's give you a little break now. Here we are. Take that out. How's that? Does your mouth feel a bit strange? Come here, let me just press the side of your mouth. I know, you'll feel like you can't really feel anything here, and this side feels super sensitive, so come here, let me just rub that a little bit for you. How's that feel? Perfect. Oh, I'm so pleased, I really am. Right, well, let's take this off you. So, I'm going to have the secretary book you in for 1 week from now. Alright. Yep. Yes, 1 week from now. We'll do a little checkup. No bread. And, yeah, and if all is good, then I'll see you the following 3 weeks later. I did want to send you home with a couple of days of antibiotics, just to be sure that we don't get any infection there. So there's yours. There you are. Right. It's been a pleasure, as always. Alright, you rest up today though, won't you? Someone's driving you, right? Good. Alright then. Well, I'll see you in a week's time. Perfect. Hi there. So I'm Alex Keeper, and I did want to just say thank you very, very much for watching today. And if you did enjoy the video, would you please maybe like, subscribe, and maybe even pop on your notification bell? That would be really super helpful. I do lots of medical ASMRs, and there is a medical playlist if you would like to check it out. So, thank you again for listening. I shall see you very soon.